Pseudomonas Stenotrophomonas Burkholderia. The genus Pseudomonas comprises of a aerobic gram-negative, non-fermentative, non-sporing, oxidase-positive bacilli which are motile bipolar flagella. Majority of them are saprophytic beings found in soil, water, sewage, and wherever decomposing organic matter is found. Pseudomonas aeruginosa. It is a slender gram-negative bacilli, 1.5 to 3 micrometer into 0.5 micrometer, non-capsulated, non-sporing, and it is actively motile bipolar flagella. It is a strict aerobe and grow well on ordinary medium. The optimum temperature for the growth is 37 degrees centigrade. Nutrient agar. The colonies are smooth, large, translucent, low convex, 2 to 4 millimeter in diameter. The organism produces a sweetish aromatic odor. It is due to the production of 2-aminoacetophenone. There is a greenish blue pigment which diffuses into the medium. Blood agar. The colony characteristics are similar to those on nutrient agar. Many strains are hemolytic on blood agar. Mechanic agar. Non-lactose fermenting colonies. It is a selective media for Pseudomonas aeruginosa. Peptide. It forms a turbidity with the surface pellicle. Pigment production. The Pseudomonas aeruginosa produces a number of pigments which diffuses into the surrounding media. These pigments are phycocyanin. It is a bluish green phenazine pigment. It is not produced by other species of the genus, hence it is a diagnostic of Pseudomonas aeruginosa. Fluorescin. It is a greenish yellow pigment. Phytorubin. It is reddish brown pigment. Phyomelanin. It is a brown to black pigment. Biochemical reaction. The Pseudomonas aeruginosa derives the energy from carbohydrate by oxidative breakdown rather than fermentative metabolism. The special OF medium of Hugh and Lifson must be used to find out the oxidative metabolism. The important biochemical reactions are summarized below. OF test oxidative, catalase positive, oxidase positive, NO3 reduction positive, glucose acid, lactose negative, mannitol negative, sucrose negative, citrate positive, indole negative, urease positive or negative, H2S negative. It is resistant to the chemical disinfectant and can even grow in certain antiseptics. It is sensitive to 2% aqueous alkaline solution of a glutaraldehyde and also to silver salt. It is intrinsically resistant to commonly used antibiotic. The Phyocin typing. The Pseudomonas aeruginosa is an important cause of hospital-acquired infection. It is essential to type the strain for epidemiological study. 3 types of bacteriocin, Phyocin are produced by Pseudomonas aeruginosa. The Phyocin producing strain are resistant to their own Phyocin, though they may be sensitive to Phyocin produced by other strains. The Phyocin produced by the test strain is employed to assess the growth inhibition of 13 indicator strains of Pseudomonas aeruginosa. Depending upon the growth inhibition of these 13 indicator strain, 105 types are recognized. The Phyocin typing is most popular method employed for typing Pseudomonas aeruginosa disease. It causes infection more commonly in patients with neutropenia, cystic fibrosis, burns, and those on ventilators. Nosocomial infections, the most important. The urinary tract infection following the catheterization, acute purulent meningitis following the lumbar puncture, post tracheostomy, pulmonary infections, septicemia in patients who are debilitated, wound and burn infection, chronic otitis media and otitis extremia, eye infection, infectal diarrhea. Laboratory diagnosis: specimen pus, mood swab, urine, sputum, blood, and CSF culture. The specimen may be inoculated on nutrient agar, blood agar, and meconic agar, and incubated at 37 degrees centigrade for 18 to 24 hours. The salty medium such as cetrimate agar may be necessary to isolate Pseudomonas aeruginosa from feces and other samples with mixed flora. As Pseudomonas aeruginosa is a frequent contaminant, isolation of the bacillus from the specimen should not always be taken as etiological agent. The repeated isolation would help to confirm the diagnosis. Gram staining and motility. They are gram-negative bacilli and are actively motile. Biochemical reactions: they are non-fermenters. They break down glucose oxidatively with acid production only. The oxidase test is positive. Biochemical reaction has been described earlier. The antibiotic sensitivity test: it is useful to select out proper antibiotic as multiple resistance to antibiotics is quite common in Pseudomonas aeruginosa treatment. It is intrinsically resistant to most of the commonly used antimicrobial agent. Ciprofloxacin, piperacillin, ticaricillin, azoxyllin, cefotaxime, ceftazidime, gentamicin, and tobramycin are used in the treatment of Pseudomonas aeruginosa epidemiology cross infection. The Pseudomonas aeruginosa is a saprophyte and its ability to persist and multiply in moist environment of hospital ward, kitchen equipments, and antiseptics or disinfectant solution is of particularly important in cross infection epidemics. The epidemics and outspread of Pseudomonas aeruginosa infection has occurred almost newborn nurses and new infants in pediatric wards. Risk groups these includes burn patients with the immunosuppression and patients who have undergone cardiac and renal surgery. Stenotrophomonas maltophilia, Pseudomonas maltophilia. This is an opportunity pathogen causes a wound infection, urinary tract infection, and septicemia. It is oxidase negative. The Burkholderia mali, Pseudomonas mali. It causes a natural disease called glanders in animal, horses, mule, and asses. Man occasionally acquires the infection from animal. Morphology: it is a small, non-motile gram-negative bacilli, often giving a beaded appearance. Culture: it is an aerobe facultative anaerobe, grows on ordinary culture medium. The colonies are small, translucent, initially becomes yellowish and opaque on aging. Human diseases: human may become infected via skin abrasion or wound through contact with discharge of sick animals. Human disease may persist as acute fulminant febrile illness or chronic indolent infection producing abscesses in respiratory tract or skin. The fatality rate in glandular is high. The laboratory cultures are highly infectious to work with. The laboratory diagnosis: specimen pollen discharge from the lesions, direct microscopy, gram negative beaded bacilli. Culture is done on blood agar. Animal inoculation test: it is done on guinea pig. Intraperitoneal inoculation of bacilli in male guinea pig causes testicular swelling in 2 to 3 days due to the inflammation tunica vaginalis. This is known as Strauss reactions. Allergy test: Mallain test. Mallain is a preparation from the organism Bacillus mali, and it is analogous to the tuberculoprotein. The intracutaneous or subcutaneous injection of mali evokes a delayed hypersensitivity reaction in animals suffering from glandular. The the Burkholderia Pseudomonas pseudomali. It is a causative agent of melioidosis, which is a glandular, which is like a disease and episodic in rodents in Southeast Asia. The organism was first described from the glandular-like disease of man in Rangoon. Morphology: it resembles Bacillus mali, but differs in being motile. Culture: it is similar to Bacillus mali. This is melioidosis. Laboratory diagnosis: the organism may be detected as a small tropical bipolar safety pin appearance with a methylene blue stain. The small irregular stained gram negative bacilli is exudate, may be isolated from the sputum, pus, urine, or blood. Burkholderia Spacea, Pseudomonas sepaceae. It is a slender gram-negative bacillus which is mounted by multitrichous flagella. Culture: it is aerobic and grow well on ordinary nutrient agar optimally at 25 to 35 degrees centigrade. Colonies appears in 48 hours. It is low-grade human pathogen and an important cause of human infection. It has been recognized as an opportunistic environmental pathogen, particularly in those with cystic fibrosis, in whom it causes fatal necrotizing pneumonia.